I'm with Cardinal Health, and I oversee a portfolio that includes PPE. And then I also manage what we call Presource at Cardinal, but that's our kitting. Those manufacturing locations are located here in El Paso and in Juarez. And what that particular group does is that we kit all the components that you would use inside a surgical suite. So it's a one-stop shop for someone that has to do surgery, and they have it all in one pack. A lot of what we do has to do with the fact that, again, we have to be a lot more careful about, in essence, the product that we put out to market. Not that anyone is taking shortcuts from a medical device perspective, but we get hit a lot harder, obviously, on our stock price. And with just the amount of products that we manufacture in a given year if we have complicated issues. So there is a whole matrix of activities, right, that has to take place to understand what makes the most sense from a business continuity perspective. Everything from regulations in the country, as to even like work environments. We want to make sure that the folks that are working in either facilities that we own or facilities that we contract in, and that we're seeing pressures all over the world, right? As we shifted production, 20 years ago to Asia, to China, that has started to tighten up and look very similar to what we see in Mexico today. In the last year and a half, we've seen this huge push to automation in these categories where we never thought automation could exist. And so that right there has really changed, where Cardinal is saying, we can make product now. We were much more myopic. We just kind of ran to the lowest cost center. Our mindset is starting to change, and we're starting to kind of understand that it's important for us to be part of like this cluster and to collaborate with other businesses in general. We have a really big presence in Juarez. We have a big presence in El Paso. We're going to be probably only people around that are manufacturing like N95 face masks in the region. And so the question that I think our local suppliers need to get better at answering is the make versus buy analysis, right? It's almost like a make here versus make there analysis. We make a huge splash about it because what is that going to mean? It means that we might attract the attention of other companies to say, oh, okay, like if they did it, why wouldn't we be able to?